This is for the Skin Cancer Patient Assignment for Health Studies by Savannah Rosenberg. Good afternoon, Maisie. That'll be our patient's name for today. My name's Savannah, and I'll be walking through some options that your doctor would like for you to know before we continue with the Moss procedure. So we have the results back from your biopsy that we just did, and it turns out the cancer on your cheek is called basal cell carcinoma. This kind of cancer is caused from repeated exposure to the sun, which you probably got when you were younger, and it happens with reoccurring sunburns as well. It's the most common diagnosed cancer and almost never spreads. Just to be on the lookout for the future, you want to make sure to look over areas on your skin where you have been sunburned and look for red patches, shiny bumps, open sores, or scars that you may find. The procedure that the dermatologist will be performing is called a Moss procedure. Remember when we first used the scalpel to take off that thin layer of skin from your cheek? Well, I'm going to remove the bandage and go over what will be happening next. See how your skin is color-coded? That's how the surgeon will know that there is still cancerous tissue in your cheek. Your cheek tissue is then looked at under a microscope and pinpoints where the remaining cancer cells are, and that is why you're back in here with me. We'll be getting more cells out of your cheek. He's going to numb it again since the anesthesia did wear off. He will continue to repeat this until all the margins or the edges around your cheek of the latest tissue sample are clear and have no cancer cells anymore. The procedure could take several hours depending on how many rounds we have to do. Hopefully it won't take that many. And that way we can get clear cancer-free tissue. Because the tissue is 100% examined using the Moss surgery, it could also take a little bit longer as well. So let's talk about after the procedure and taking care of your wound, that way it doesn't get infected. So fortunately, the Moss surgery does not use any extra tissue and remains with the most viable tissue as possible and usually leaves the smallest scar. The dermatologist will perform a dermatoautoplasty that will use your own skin for a skin graft for the best recovery. Undergoing plastic surgery does require you to take care of your wound. Whenever you're done here, you're going to have a list of instructions and you just have to follow those. If you have any questions, you can always call us, contact us at any time. You'll be given these after the surgery, and just a few points to make out: just stay out of water for at least the next 24 hours. Swelling is common, and so is some oozing from the wound site. You want to make sure to take care of your incision site so that it does not get infected and progress into anything else from an infection. So in order to have a follow-up, we want to definitely schedule one, and whenever works best for you, but we would definitely like to see you within the next 2 to 4 weeks to remove the stitches and to just double-check everything and go ahead and finish it up. So do you have any questions, comments, or concerns that you'd like to bring up? Maisie?
No, that was very informative. Thank you.